Yeah.
Hey guys, it's Dr. Patel here from Lift Plastic Surgery.
Dr. Trong also. How are you guys doing? Welcome to our talk today on mastopexy. So a lot of people do come up to us, a lot of women inquire about breast augmentation or even for the mothers out there, ask, what can I do to help regain that fullness I had before pregnancy, before breastfeeding? And so these are some of these questions that people will sometimes have for us.
Yeah, it's not just the fullness, but also they ask for a lift, right? And they want to get the nipples back in the right position. And so, our topic of mastopexy. So we're gonna kind of go through some of the commonly asked questions and go through like what's possible and what's not possible, right?
Yeah.
And so a lot of women ask like, okay, well, I've kind of gotten deflated after breastfeeding, and what can I do about this, right?
Right. So depending on an evaluation by your plastic surgeon, you're going to want to ask, or really want to look in the mirror and decide how big do you want to go, and then what was your pre-baby, pre-breastfeeding, pre-pregnancy look that you want to achieve. And a lot of this can be done with just an implant alone. Now, a lot of women and a lot of surgeons, even in the past, used to, not unilaterally, but after some measurements, would decide that a lift and an implant would do the work. But these days, the implants come a little bit differently, right?
They do. They have a little bit more projection. And so with the different types of implants that are out there, the more projection, the more it sticks up from the chest and also helps lift that nipple if we're able to do something that we call a dual plane technique, where it helps lift that nipple position.
Yeah. Is there a certain measurement, or is there a threshold you have before really deciding upon, I think a lift is a better option with the implant?
Right, and so I think it comes down to a couple different factors. One is about 2 centimeters is kind of almost the most that you can get in terms of a lift with an implant, but it also depends on how bad the nipple and areola has kind of come down. How far below the fold is it actually sitting at? And so that also helps determine whether or not you need a lift in conjunction with an implant, or if what about those patients that want just a lift alone and no implant?
Right. So with just a lift alone, so a lot of women are rightfully weary about placing some foreign body in their persons. We're under the mindset that silicone implants are very safe. The FDA has approved them, but we certainly understand that there are patients out there who continue or who do have troubles with silicone implants. That being said, if you decide on just a lift alone, realize that after reshaping the breast, it may look perhaps a little bit smaller after the lift, and you may not achieve that complete fullness and that upper pole of the breast that you're looking for either. And that's something where an implant will help get that projection that some women are looking for. Obviously, other women out there are just saying, I don't want my breasts to drag as far down as my belly button anymore, in which case, certainly a lift is more than enough to keep these patients happy. But for those looking for a little bit more volume, for a little bit more fullness, that's where I think most surgeons can agree and most patients can agree that it's going to require a little bit more finesse and a little bit more work to get that look.
Right, and just it helps the look, but it also helps where the breast tissue sits on the chest. And so it can also help some kind of discomfort in the neck or back as well. So if you put the breast in the right place, you also have less strain on some of the areas that now you have strain from gravity pulling everything down.
Right, versus like middle or lower back pain, we're concentrating most of the breast tissue where it should be, which is above the level of your natural breast fold. And every woman has them. They may not be symmetric, and that's something we strive very hard to try and get that straight line across.
Absolutely. And so, like we talked about, it can be a little bit smaller, but they will definitely, with just a lift alone, because we're taking some tissue out and some skin to try to get that shaping and that position correct.
Right, and it's all a matter of trade-offs. So we're trading off position of the breast for a little bit more scarring. But by and large, I think that is a sacrifice that some women who have particularly drooping breasts would go for. There are certainly different techniques and in different ways to achieve and go about this, but that's something that you're going to have to discuss with your board certified plastic surgeon to figure out which is the best, or which technique will achieve the best result for you.
Right. So you mentioned scarring, right? So what are the different options of scars?
Sure. So, the tried and true method that will both lift the breast and narrow the width a little bit is going to be what we call a Wise pattern. It looks like an upside down T. Some textbooks, websites, social media will refer to them as an anchor scar if you're looking directly into a mirror. So that includes a scar around the areola, one that comes straight down from there into the fold of the breast, and then one that follows the breast itself.
Yeah, it's very wise.
Extremely wise. That's how you spell it, in fact. Other techniques are able to achieve that with just a little bit of a modification for that, and that is a scar around the areola, and then one that goes straight down on the breast itself onto the chest wall. It may curve a little bit, it may be straight, but at least it avoids that long anchor incision.
That's called the lollipop, right?
The lollipop scar, that's
Yeah.
right. And then thirdly, another way to do it is just a scar around the areola. And some women are able to achieve that look without much scarring whatsoever. And I think that's a scar that hides extremely well. Even through any of those scars, you can place an implant in as well. And I think that is something that we've both striven for to finesse the look that patients are asking for.
Yeah, and then what's recovery like?
Recovery for mastopexy is very similar to a breast reduction or even an augmentation. It depends really on how much work is being done. I would advise patients rather plan on being out of work that's not particularly strenuous for probably a week.
Okay.
Most patients are usually back to work a little bit after that time, but we certainly don't want our patients to be doing anything strenuous out in the yard working, doing household chores, or doing any heavy lifting for about 4 to 6 weeks, really, depending on what type of scar shape and whether or not an implant is placed and where the implant is placed as well. Lots of variables in there, but know that there's no exact set time frame for anybody out there, for any one person. These are all guidelines, really, to anticipate what your recovery is like.
What about swimming? I mean, summer season's almost here. People want to get out in their bathing suits and take trips.
For me, for getting in the pool with, for big scars, typically I recommend anywhere from about a month, give or take, just to make sure that the scars are fairly well healed. I'm a little bit more conservative. I don't know. Are you longer, shorter?
Yeah, about 4 to 6 weeks. It depends on how the healing process takes place for that. And then, we get this common question about breastfeeding,
for those women who didn't anticipate or had a surprise baby after a breast lift or a breast lift and implant, it should not affect your ability to breastfeed. The less than 1% of patients have any type of permanent inability to continue to do so. For those women who have not had children yet, it's almost a grab bag rather of knowing whether or not you're going to be able to breastfeed before surgery anyway.
Right. Last question, nipple sensation. Like, does it change? Is it more or less sensitive? Can it go away? What's the deal?
Yeah, no, nipple sensation, the way that the mastopexy is performed, every surgeon is looking to preserve the sensation as well as the lactation abilities of the nipple itself. So it's carried on something called a pedicle. That's why it's important after your surgery, or even at some point, to ask your surgeon what design he used, so that in the future, if you decide that or need other types of breast surgery, then your future surgeon will be able to thank him and you about how to plan those incisions. But permanent loss of sensation to the nipple is extremely rare. We're looking at 1% or less. As long as the techniques are carried out in a safe, straightforward manner and applied in the principles that we've all learned through the years are applied swiftly as well as safely.
As well as avoiding nicotine, right, and smoking.
It's true.
And so that's the other kind of piece of it. We can do our part in terms of surgeons of doing that piece, but the other piece is kind of the makeup of what our patients do in terms of taking care of these pills.
That's so important. So for for our audience who does smoke out there, is there a certain time frame they need to look to stop nicotine products prior to having surgery? I don't draw a lot of lines in the sand, but I generally try to have my patients about a month off of nicotine products before attempting any complex surgery with either long scars or anything working around the nipple, just because of that incidence of potential loss of sensation, blood supply, and discoloration to the nipple itself.
Yeah, I'm usually a 6-weeker, right? So
Okay.
6 weeks before and at least 6 weeks after
Okay.
is kind of my recommendations, because that's where I think the healing happens. And so getting your body primed for surgery to then get healed for surgery, I think
Right.
is the same kind of thought process.
Yeah, and it's the only way to achieve optimal results. It's already fraught with potential hazards out there, and adding one more dimension to it, I think, is just a little bit playing with fire.
Yep.
Yes, there are women out there who've had no problems whatsoever, who, patients who have been dishonest and gotten away with it. But I think for the most part, I find patients to be very trustworthy and honest about their medical histories, and maybe that's just maybe I'm in the small minority here, but at least I'm hoping on my patients just so that we can optimize those results, just because I feel like we're in it for the long haul.
Absolutely. So if you have any questions, be sure to reach out at liftplastics.com. Give us a call, 832-835-1131.
Yeah, you can find us on Instagram at Lift Plastics. We're on Facebook as well. Leave a message, leave a comment, ask us how we're doing. We're happy to answer those questions.
All right, you guys take care.
Have a great day.